I think we are live. Good evening, everyone. I'm Dr. Sandeep Sharma. I'm the pediatric faculty at Doctor Tutorials for NEET PG, FMG, and NICET. FMG results are out, and I'm joined by a topper, a achiever. And she is not just any other ranker or FMG aspirant who has cleared the exam. You need to have a look at the score she has got 238. It's not just 150 plus, it's not 180 plus, it's not 200 plus, it's 238. So it's my privilege to invite her to this interview. Congratulations, Dr. Samyukta.
Thank you,
Welcome to
sir.
this
Thank you so
interview.
much.
And
I'm honored.
please tell me first thing, is it sunk in yet? How are you feeling right now?
It has not sunk in yet. I'm literally feeling like like so surreal, so happy. I can't explain it in words really.
And I'm quite sure your family is also very happy and proud of you
Yeah,
at this.
yeah.
Before we
They are,
start,
they are.
before we start with how you actually did it, can you please tell us about yourself, what place you belong to, and where you did your MBBS from?
Okay, so I'm Samyukta. I'm from Chhattisgarh. I did my MBBS first from Ukraine, Uzhhorod National University, and then I got transferred. I transferred to Georgia, Caucasus Medical University, and this is my first attempt in FMG.
So you took about like coming back to India, you roughly had about 6 months to prepare. So
Yes.
what was your game plan in that phase? How did you go about it?
So for the first 2 months, I guess like 1.5 months, I was like, I need to complete all the concepts, need to complete all the videos, like the main videos. And after that, I was like, I started my revision cycles step by step.
Okay.
Yeah.
So basically, you were reading already when you were doing MBBS, right?
Yeah, yeah. When I
You were
was in college, I already started.
okay. So one reading of all the major subjects you had already done at that moment. But then
Yes.
it's the revision part which actually makes a difference when you try to compile everything together. So how did you go about that particular part?
So for the revisions, uh, I had like first I was like the planning. The planning was important. Like I have to do these subjects in these days. Some buffer days was also there. Some always like GTs. Every week I gave one GT, and I also planned like I need to give at least 100 MCQs every day. So I think I made a plan. I think that's the most important thing, that for this 1 month I need to complete one revision cycle. Then after that it became shorter and shorter, as Rajiv Dhawan sir says, like make your plans like a pyramid, and that's how I did.
Yes. So Dr. Sanyukta, what was the doctor tutorials resources you utilized for your preparation?
I joined the this FMG revision booster. For 3 months I took it, and I think it was a wonderful decision. I think I am gonna say was the like the changer, the game changer for me, especially. Like I'm so happy that I took that decision. Uh, the revision, how I approached the revision changed. How I became the revision became a lot more easier for me, like planning wise and everything. I got the PYQs. I did the CPR. The CPR was absolute gold. I must confess.
So CPR, you found it useful. CPR we have actually created in a way that it is doable and at the same time high yielding. So what were the subject teachers and subjects, faculty members, who you specifically want to uh, give a shout out to at Dr. Tutorials?
I actually loved every teacher of dog tutorials. I can't say anyone, but I must say the name Sandeep Sharma sir for pediatrics. Absolutely, I loved it. I must say, and ENT sir, Rajiv Dhawan sir. I already had attended his classes in Georgia, so I was like
Hmm.
already knew how he taught, and I yeah.
Yes. So, Dr. Sanyukta, do you feel that would you be recommending the doctor's revision programs and the CPR sessions and all these programs for your juniors if they want to compile their preparation
Absolutely.
together?
Absolutely. Like, if you are not sure where you are, how to approach the revision, I think revision booster plan is an amazing plan. And the CPR literally helped me so much. Like some questions, even like I was like, oh, I remember that from that sir was saying, even when I was giving the exam. So even that was like, seriously, I must like say that I would recommend it to my juniors for sure.
Thank you. Thank you so much for your kind words. Dr. Sanyukta, one more thing about the exam per se. There was a very mixed feeling after the exam. A lot of people said exam was easy. Some people said, sir, it was very clinical. Some people said it was very integrated. Like, what's your view about the paper one part and paper two part? If you have to advise someone that how the paper is evolving, how would you summarize these papers?
Okay, so according to me, first paper was comparatively easier for me. I found it easier because more questions were more straightforward. So at least I knew, okay, this question I know, and this question, yeah, I guessed it. But so I was happy with the first paper. But second paper was like a bouncer. Like it was integrated. It was lengthy questions. Time was I felt was less. Um, More clinical based. So I did answer those, but I was also like unsure of my answers, like is this correct or maybe not. So I think paper was more like people will be unsure of their answers, but in first
Yes.
paper I think because of more straightforward, they would know, yeah, they did correct.
And one thing which I like, not just me, but all my colleagues at Doc Tutorials and even my fellow colleagues at other platforms also, we all have been telling to students again and again that the days of only ultra short revision, only one-liner cramming, mnemonic cramming, and sitting in the exam, those days are over. But some
Mm.
people still do not understand. What message would you like to give to those people, especially who have that this impression that only by doing a few topics and a few subjects and some mnemonics they will crack the exam? Is it really so easy?
No, not at all. Like as you said, like ultra short revisions won't do now. Like it's so integrated. Like so subjects are integrated. You need to really understand the concept now. Like a lot of questions, acid base disorders, and these all a lot of questions were there where you had to really know like understand the question. Like I found like especially in the second paper, I found it like a lot of it were integrated and clinical.
Yes.
And
Yes.
yeah, the concepts have to be strong. You're honestly, I would say the
So
concept needs to be strong.
So what basically Dr. Sanyukta is saying is, for all those who are listening to this interview and you are still, in your outside India in your medical college, whatever reading of the subjects you are doing right now in your medical college, that is going to be helpful because it will build the base concept. Once you come to India, first couple of months, try to finish off the pending syllabus, pending subjects once, and then start with a proper revision. It should not be a one day one subject revision, it should be a proper revision. CPR session she has found useful, revision booster program she has found useful. Similar things which are scientifically created by subject experts should be followed. And Dr. Samyukta, what about the MCQ practice? You said you were doing 100 questions per day.
Yeah,
So,
minimum.
what ideal number of questions? Like some people are like 50 per day with explanation, some are like 300 per day. What's your take? What is that ideal range?
For me, from the first day, I had after coming back to India, I made a plan like 100 MCQs per day, and it's not difficult. I think 100 is minimum 100 is not difficult, and also I like kept it like every pharma I found it difficult, so I kept it like every day at least 10 to 15 pharma drug of choice I need to do. So that's how like I started 100 questions, and then last 2 months I guess I kept it like 150 to 300, and till the like last month I think I was doing a lot like 200 to 250 MCQs per day.
Awesome, awesome. So you did everything well, and 238 score also means my advice to you: yes, celebrate, but carry on the momentum. You are
Yes.
destined for bigger things. So don't just give up. Carry on this momentum with negative marking. NEET PG is also definitely on the platter for you. So, but
Yeah.
for now, yes, celebrate this success. See, this success would not have been possible without the support of many people. Who are the people you want to dedicate this success to? Shout outs to your friends, family member, each one. This is your time.
I want to shout out to my family first. Really, they were really supportive for me. Like till till the end, till the day of exam, they were like fully supportive. My mom, my dad, my brother, uh, Siddharth, and my all my extended family members. They were like really supportive. They believed in me. They would call me up and they say, we know you can do this. uh, don't get uh, don't get any fear or anxiety. I know we know you can do it. So I want to thank my friends. Whenever I used to get stressed or anything, I would call them up and like just tell my frustrations to them, and they will like go like, okay, yeah, we know we can do this. So really, everyone in my life, I'm really really honored.
We are
And
actually
to you, Dr. Tutorials. Every teacher, how they motivated, like really, I think the mentality is also important in these exams. Like there were multiple times when you get like stressed, when you get burned out. So I think for keeping the momentum, you teachers really really helped us.
we try our best, but at the same time, as I always say, we can only provide you the service. It is up to you to utilize them. And what a way you have utilized, Samyukta. You are really a role model for a lot of the young generation who are coming up. Any last message to people who have not done well? June is coming. Any
um
message?
I want them to know that don't take the result to the heart. I want them to know that they've already done a lot. So that extra mile, just they need to cover that extra mile to get that passing percentage. They have already done the half and just need to go that extra mile. And I know they can do it for with determination and hard work. Really, they can do it.
Absolutely. It's just a matter of time. And Sanyukta
Yes.
has given some very valuable suggestions. Please listen to this and try to incorporate. So, Dr. Sanyukta, on behalf of the entire doctoral team, I again wish you all the best. And please convey our
Thank you.
greetings
Thank
to your
you so
family,
much.
friends, and your brother also, so that, you keep shining. And maybe 1.5 years from now, we again take your interview. But this time
Yes,
you've
for
cracked.
sure.
Need PG, and not just need PG, maybe INI set. So,
Yeah, for sure.
bigger dreams, new beginning. All the best.
Yes. Thank you. Thank you so much.